Yeah, so we're going to be focusing in on the FDA regulation 21 CFR Part 820 and then the ISO 13485. So we're gonna start by breaking those two down and understand, what do they say about purchasing controls? What's their thought process on them? So here's 820.50 on purchasing controls, and you look at there's a lot of words in here, but what does it really say? It says each manufacturer shall establish and maintain procedures to ensure suppliers can meet the requirements. So I think that's a key point to pull out, that as manufacturers, we need to have procedures to make sure that the suppliers can meet what we're asking them to do. The next part of it is, we need to evaluate and select those suppliers based off their ability to meet those requirements. So, we set these requirements, but when we're selecting suppliers and we're evaluating them, we got to make sure that they can actually do what we're asking them to do. I think that's a key point, and we'll get to that more too when we're talking about supplier evaluation and also non-conformance trending and thing. It'll touch again on that. Define the control based off the supplier type and evaluation results, and have an approved supplier list. So, supplier type and evaluation fight. All suppliers aren't equal. So you can have a pest control supplier that's monitoring your environmentals in your manufacturing room. They're going to be very different than a contract manufacturer or a critical component supplier. So, break those suppliers down, understand what their risk to your business is, or what the risk to the finished good is, and then evaluate them and manage them appropriately.
So, Chris, I'd like to ask you, so like in the time frame, and I started my business in 2015. I mean, I've seen multiple scenarios where as businesses have grown and they're using different suppliers where the actual company did not have a supplier program in place, and 2017, 2018, where they had to start it from scratch, or where the supplier, was growing in business, they're providing a particular value, but maybe don't have best practices set up in terms of what that should look like as they partner with somebody that they're supplying to. So maybe you could speak a little bit to, and I don't want to steal your thunder if you're going to talk about this later on in more detail, but as when you first start to deal with a supplier, maybe some ideas of how you go about evaluating that piece of it, what that conversation looks like.
Yeah, absolutely. And we will get into that a little bit on the evaluation piece, but I think it's understanding where the supplier is in their quality journey, in their culture journey, where they are with their quality culture and their quality management system. There's so many different ways to implement a quality management system, and there's no wrong way. There's the regulations are written the way they are to allow that, and you need to work with that supplier, understand, is their quality management system, is their way that they've set it up going to be able to meet your needs. So it really just goes back to this statement up in CFR 820 that says their ability to meet your needs. So if they're meeting your needs and they're set up to meet that, you're in good shape.
Okay, I appreciate that.
So, but we'll get into a little bit about evaluations, because there's different evaluations for different types of suppliers, based off the risk, but it all comes back to risk base.